Hello, hello, hello. Jill IC Network. We're here for another live support group meeting. I got to get my other stream set up. Give me one moment. All right. All right. We got Facebook working. Yeah. It wasn't working a minute ago. Hi, guys. How are you? How are you? How are you? How are you? It is Sunday, September 12th, the day after 9/11. I try to imagine how we were feeling 20 years ago as we were going through such a terrible trauma. Anyway, my name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. It is time for another national support group meeting. I'm a little bit late today because I had some other things that I had to do. Specifically, we have the American Urology Association conference finishing up today, and I've been participating virtually in that. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to be able to hurt you by saying that IC isn't real or it's untreatable or anything at all like that. That's absolutely not true, my friend. Not true. IC is real. IC is treatable. And guess what? Instead of thinking about IC as an incurable bladder disease, we now think about IC as a pelvic pain syndrome. Hi, DJ. How are you, hun? Yeah, so we got started a little late. I had something I had to do. And so, if y'all want to do a spoker meeting, that's fine. If you don't, that's fine too. I got plenty of other things that I can do. Life is very, very busy now. Hello, Jennifer. It's nice to see you, hon. I hope that life is treating you well. Let me just make sure here. I gotta, the Facebook picture is you guys get to see my imperfections all up front, including my pimple that I've tried to cover up. I have no shame. I'll talk about anything. I didn't do a very good job of it, did I? DJ says, it's like you know that my bladder's angry. Possibly. Here, one sec. Hold on one sec. Okay, I hope that that's better. No, it doesn't look like I have a white spot anymore. DJ, honey, what kind of flare are you having? What's going on? Do you know what triggered it? Pam said, not healing good. Bladder pain. Could it be from the contrast I had Friday for a CAT scan of your lungs? It's happened before. I mean, I will say that we have had some patients who have had to have an examination that required contrast solution where they have flared from it. It has certainly happened before. So that is very, very possible, my dear. Plus the stress of it. I mean, girl, seriously, the stress of having a any sort of procedure like that, whether it's an MRI or whatever. Listen, it's rough. Give yourself a break. You went through a very, very difficult test. And I can understand why you would be struggling. Hello, Rada from Atlanta. Nice to see you. Hello, Laura. Nice to see you. Hi, Jennifer. Jennifer's doing well. Hi, Nancy. I can't say, but I deeply appreciate your work. I've referred a few Facebook IC peeps to you who are struggling. See you soon online. Yeah, guys, you can send anybody that you want to me. I mean, that's fine. DJ said, what? I had my intestine placed on August 2nd. Now you have another E. coli ESBL infection? Girl, what? Where's the infection? I mean, so is the infection in your kidneys or is the infection around the interstim device? Yikes. Yikes. So I was very plaintive last night. So normally when I do these meetings, you guys, I normally have like a 30-minute lecture, and then I would take your questions for a couple of hours and maybe do Zoom, something like that. Obviously, today's different because I couldn't start on time. And so we're just going to kind of do a drop in meeting. Dawn says she's concerned you haven't had a flare for many years, but thinking I could now, can kidney stones cause a flare? Yeah, kidney stones can certainly cause a flare, because kidney stones, hon, can be extremely rough. Some kidney stones might be smooth, others can be really, really rough and sharp. And so, if you've got a kidney stone floating around in your urine, let's just say it's so big it can't pass through your urethra, um, then that kidney stone is doing the equivalent of cutting the walls in your bladder. And that would explain potentially why you're struggling with a flare. Also, understand too that sometimes some of the things they ask you to do to help prevent kidney stones might be a little bit irritating. Dawn, you also have to remember too that for every woman, there comes a point in time when hormones catch up. And so let's say if your IC began in your 30s and we got it really controlled, and in your 40s, you're really good, just very, very few flares, and then bam, in your 50s, you all of a sudden start getting a lot more bladder sensitivity, bladder irritation. Why? Well, we know why. It's because of estrogen atrophy. Estrogen atrophy can play a huge role in symptoms. Hey, you guys on YouTube, how is the sound quality? I don't think I set up my sound correctly. Hold on a sec. Did it give me a chance to do that? Hmm. So YouTube, how's the sound? Is the sound okay? All right. Your kidney stones were diagnosed last week, so now I see with stones, and it can't determine why it hurt your bladder. Yeah. Well, your kidney stones are rough, hon, and you got to remember that one reason why some IC patients struggle is that they stop drinking a lot of water because you associate water with having to go to the bathroom all the time. And so there is an IC patient out there who at one point in time said, okay, the only way I'm gonna get sleep is if I don't drink water after dinner time. And of course, unfortunately, what happens then is that you end up super concentrating your urine. And when you super concentrate your urine that way, the crystals in your urine start to crystallize and attach to each other, and potentially create yet more stones, right? And I told the story a couple of times of an IC patient that I worked with who um, developed stones and also a really bad flare when she was traveling to Europe, because on the flight there, she didn't drink water for about 14, 15 hours. I mean, really, she deliberately didn't drink a lot of water. And then when she got there, when she got to Europe, because she was afraid of the water quality in Europe, she was drinking more soda. And so she was in Europe for, I don't know, 2 weeks, something like that. And then on the drive home, what do you think happened? On the flight home, she didn't drink water again. And by the time she landed, she was in agony, absolute agony. And, she was thinking really, really severe flare, yada, yada, yada. And she wasn't having, she was thinking really severe UTI, and it was not a UTI. It was just massive bladder irritation from super concentrated urine combined with estrogen atrophy, combined with a really poor diet for a couple of weeks. Thank you, Heather. I appreciate that. Thank you, Arlene. DJ said, it's just your third one since August 2nd. It's in your kidney. Your urine is literally blood. Holy shit. Oh, I'm sorry, honey. Sorry for the curse word. Sorry for the curse word. It happens. I'm at that age where it's okay. Well, hopefully, DJ, girl, you've let them know. doing it, hopefully a next generation urine test so that they can really identify exactly what's going on and get you the right therapies, right? Hi, Christy. DJ, I feel like you can see me before bed now, girl. you know, you can't kid a kidder, or you can't fool somebody who's already, been there. And fool's not the right word, honey. I've walked in your shoes many, many times, many, many times. And I think that, that's why other IC patients make really good support group leaders, because we know what it's like to be up in the middle of the night begging God to make it go away, because you're so sleep deprived, and you just can't feel good. You don't feel good and you can't sleep. So everything that we do on the IC network it comes directly from personal experience, because we've been there. Jody says, currently on day 5-ish of my period and have cramped so bad and bloated. I feel like my period causes flares sometimes. Jody, your bladder is remarkably sensitive to changes in estrogen levels and hormones levels. And that is why IC patients will often flare the day that they ovulate. I used to. That's like a 10 or 12-hour flare that goes. I mean, that's like one of the advantages of you tracking your symptoms over time, is that you can start to see those natural flares. And so for me, I absolutely flared when I was having my period, no doubt about it. And when I ovulated. The period flare was usually 2 to 3 days. The ovulation flare was usually 8 or 10 hours, 12 hours, something like that. And I learned not to fear it. It's like, oh yeah, I'm ovulating, no biggie. And when you kind of take the worry out of it, one of the challenges that we have is that when we have a severe flare, it's scary. It's like, oh my God, what if it never goes away? Right? I mean, we call it the runaway train of emotion and reaction when you have a flare. And it's really important that you not allow yourself to do that. You should not do that. It's a flare. It's okay. You are living proof that you flare and that you get better. I am living proof you can get better. And you always have to remember just a little bit of context there. Flares happen. Some people are really confused because they're like, I did really well for 5 years and then it came back, and I don't understand why it came back. And that's why it's so important to think of IC as more injury than illness, because number one, we haven't identified a disease process happening except in patients with Hunner's lesions or maybe with a little bit of chronic infection. But what we do know is that a number of patients have injury or trauma to their bladder from chemotherapy, from drinking too much diet soda, whatever. And so, I always say, well, honey, the reason you felt good is because your bladder had a chance to heal. Now, the reason you're in a flare again is because you hurt your bladder again. The bladder, like any other part of the body, can be hurt. It can be hurt easily as you get older, easily. And in today's modern diet, where we're drinking massive amounts of crazy stuff, which is really chemically traumatizing to some of those tissues. Angel says, what can I do to keep the flares down? Well, Angel, you got to understand that there are different types of flares. You can have a bladder wall flare. You can have a pelvic floor flare. A bladder wall flare can be from a change in hormones, or it can be from you eating or drinking the wrong thing, or taking a strong medication like Augmentin or ketamine that might irritate your bladder. And so we want to avoid things that can really irritate and traumatize your bladder wall. And we have a bladder wall flare protocol. Angel, if you come on over to our website, which is icnetwork.org, you sign up for a newsletter, we have a 40-page flare management guide that has hour-by-hour rescue plans of how to get yourself out of that flare. So we have a bladder wall flare, but we can also have a pelvic floor flare. The pelvic floor flare happens if you're in a car for a long period of time driving, if you're traveling, if you're having sex. And our therapeutic priority for the pelvic floor flare is very different than a therapeutic priority for the bladder wall flare. If it's your pelvic floor, we're going to be doing things that are going to relax muscles, right? So you might be using heat to try to relax those muscles. You might be using an internal wand that your physical therapist has recommended to you so that you can get in there and work with those muscles, and which is exactly what I do. Or use a muscle relaxant, like a skeletal muscle relaxant, like Flexeril, Baclofen, something like that. In contrast to a bladder wall flare, our therapeutic priority is to calm and soothe the bladder wall. And how do we do that? Well, number one, let's just assume you had a couple of drinks last night, whatever your poison is. Today you've woken up with your bladder very irritated. So the first thing we're going to do is drink some water to dilute your urine to make sure we don't have any irritants in there. The second thing you might do is alkalinize your urine with a little bit of sodium bicarbonate, a little bit of pre-leaf, something that will try to reverse some of the acid that might be triggering your bladder. And then we might be doing an azo, something that will numb your bladder wall. Azo bladder pain relief tablets that can numb your bladder wall. These are the flares where you might have to use some pain medicine if you have some pain medicine, if it's particularly severe. And if it's not resolved in a day or two, calling your doctor and asking for a rescue installation is reasonable. Now, there was something very interesting that happened with azo. Let me grab, and you guys, listen, I'm super casual today. Overalls. It is what it is. Ow. Ow. Oh my goodness gracious. I have this ruptured disc that's affected my right leg. If I sit too long, my right leg gets all weird. Azo bladder pain relief tablets, pyridium. It's the over-the-counter version of pyridium. It's the stuff that turns your urine orange, and it acts by numbing your bladder wall. Well, my friends, guess what's on the new boxes? A cancer warning. Yes. On the new boxes of azo, I had a customer call me and said, "Hey, do you know anything about this new cancer warning on azo?" And I went, "No." And I looked at mine. This box, which we probably got 3 months ago, does not have the cancer warning. But if you go to their website, the new ones do. Apparently, they have now made a direct connection between the active ingredient in azo, which is phenazopyridine, and cancer. I don't have any more information on that. I told her, I said, it's got to be titanium dioxide. It's not. It was actually directly the medication itself. So I will try to get more information on this new cancer warning with us. Because the last thing you and I need is to be exposed to anything else that can screw up our bodies, right? Jennifer says, "What are the wildfires like in your area so that I can follow them?" We had an arsonist. I think Monday night, we had an arsonist start 15 fires. They started at 8 o'clock, and they just went around all the country roads around our warehouse up in the Dry Creek Valley. 15 fires. And we're sitting here going, "Oh my God, another one. Oh my God, another one. Oh my God." And then 2 of them were really close. And the thing about these fires is that they move fast. The great news is that whoever the idiot was who was starting the fires, just he wasn't smart with where he picked it. So I think the biggest one was, I don't know, like 5 acres, something like that. They got them all under control, but I was up most of that night watching the fires, especially because on our farm, they were picking. It's harvest season, and picking starts at 3:30 in the morning. So I knew my sister and her family, where the fires were starting around them, were in bed trying to sleep. And so I made a double effort to stay up so that I could notify them if there was an issue. So I didn't get much sleep then. Right now, no fires. So we had a fire yesterday. We had lightning. We had a lightning storm 2 days ago. Lightning hit the hill over here. I had a lightning fire maybe 3 miles away, but they got all those down. So aside from the stress causing a breakout of my pimples, we're okay for now. Let's just say that I'm using a lot of cover up today. Are they as bad as they were last time? Well, honey, they're much worse. The fires are much worse this year than last year. Heather says, "Do most people with IC have symptoms all the time, and the flare is an increase in those symptoms?" I mean, okay. I'm going to say no. And the reason why I'm going to say no, number one, I have to draw from personal experience, right? That I don't have symptoms every day anymore. And for me, when I have symptoms, they're all pelvic floor driven. They're really not bladder wall driven, but let's just say that I'm very careful to protect my body in general. Um, I have to go by the phone calls we get. We get so many phone calls, and it's amazing the number of people who say, Jill, you helped me 5 years ago. I was really good, and now my symptoms are back. Can you help me again? And so I do think, and what the research shows is, let me try to get this correct. What the research study showed, the last research study that I'm thinking of showed that patients usually got their worst within the first 6 months, and then they just slowly and steadily improved. And I don't, but that's an old research study from like 18 years ago. So again, usually patients hit their worst in the first 6 months, and then they just slowly and steadily improve. But of course, we can flare, get better, get worse, but there's usually a gradual uptake. And I think part of that has to do with learning about and understanding the things that you've got to do to try to protect your bladder, et cetera, et cetera. Angel said, "Azo made you hurt worse." I believe it. Azo never did anything for me. Never, never. When I was having old bladder wall flares, I mean, Azo never touched it. It is a very mild, innocuous effect. My uro has 25 other urologists in his practice and says they never had to stop patients from taking pyridium, and it's the only thing that stops the pain. He said, I need to be checked for a cystocele. My uro is not getting this checked. I mean, I can tell you for me, it never helped my pain. But see, now we know that my pain was primarily muscle driven rather than bladder wall driven. So that might explain why Azo didn't help me that much. Okay, Jennifer, hit me. I love strange questions. No shame. I mean, and no embarrassment. You know me, I'm willing to talk about anything. Lindsay, congratulations on your pregnancy. You're going to make a great mother. I am so, so happy for you. And you were in a 4-year remission, but now you are struggling with a flare again? Well, sometimes that happens, with all the change in hormones. About half the women who get pregnant get a little bit worse during the pregnancy, and the other half go symptom free. Hello, Caroline from England. Lindsay, we just did an article on pregnancy in our summer magazine. And if you email me, Lindsay, I want to give you my email address. It's icnetwork@mac.com. icnetwork@mac.com. I will send you a copy of our magazine so that you can see the latest article we did on pregnancy and IC, okay? Hello, Caroline from England, if I didn't say that already. Hello, Jenny. Jenny says, I've been struggling lately. My insurance decided to stop paying for Elmeron, so I'm off Elmeron for almost 4 weeks. I need other treatment plan and suggestions. Okay, so, that's not a bad thing, honey. Jenny, Elmeron has now been linked to pretty severe eye disease. This is a good thing that perhaps you're not using the Elmeron anymore. Understand that Elmeron works by providing a bladder coating effect. And so what we want to do is we want to look at other therapies that can do the same thing. So as an example, what you could do is you could switch to Elmeron bladder installations where they put 100% of the medication directly in your bladder, and it tends to stay in the bladder. Whereas, the challenge with Elmeron is its bioavailability. The company itself released a study years ago, the original company, Baker Norton, which showed that 92% of Elmeron is destroyed by digestion. And so that means only a little bit, 8% or maybe even less, arrives in the bladder to do anything meaningful. And that's why you have to take Elmeron over time to get better. And of course, that's now, I think, why we're seeing some of the eye disease is because patients have to take quite a bit of it. When you take it orally, it ends up in your bloodstream and gets distributed throughout your body, including up to your eyes, which would then explain why we're having some eye issues in some patients. There is no other prescription medication on the market that has a similar effect. And so if you don't want to do the bladder installations, you would be instead looking at the chondroitin-based supplements. You would be looking at Cysto Protect, Cysto Renew, Bladder Builder, Bladder Rest as options that would provide a similar coating effect. And if you go to our main website, icnetwork.org, there is right on the front page an Elmeron transition guide, which gives you options on things you can do if you've had to get off of Elmeron. And while we're talking about this, guys, you have to understand that the statute of limitations is almost done. In some states, it's already over. So if you have taken Elmeron and you have eye disease, you have a very small window now to actually become part of the lawsuits. And so there's a website, elmeronlawsuits.org, that you need to go check. And out of an abundance of caution, you might want to just give them a phone call and just to see if you can find out what your statute of limitations is, to see if you might want to participate in that or not. Right now, there are over 400 cases that have been filed. It's either 422 or 442 cases filed so far on behalf of IC patients with eye disease. And the first case is scheduled for trial in about 14 months. So things are moving along, but the statute of limitations is a hard and fast limit that you can't change. I mean, if you decide a month too late and your statute of limitations is expired, you will not be able to participate. So please, if you have any doubt, just give the Elmeron Lawsuits team a quick phone call and ask them. They can check for your state, okay? Mrs. says, my bladder multivitamins do not have an expiration date. I emailed you twice, no response. Honey, I did not get an email. If you emailed through Amazon, that's a different story. But if you emailed through me, I did not get your emails. They might have ended up in my junk folder, but I sincerely didn't see them. All of the natural approach nutrition supplements have an 18-month expiration date. And there's I don't know how to exactly explain what is happening with different changes in the labels. Our challenge here is that factories have to go through a wide variety of certifications, and there's one type of certification that is so incredibly advanced that they require not the expiration date, but the manufacturing date on the bottle. And that's the factory that is producing the natural approach nutrition products. And so we have been in discussion with them because a lot of people are saying, what happened to my expiration date? And what they're saying is the manufacturing date is more important than the expiration date for tracking purposes. So they have asked me to tell you that it's 18 months is the expiration date for any of the natural approach nutrition products. And we're going to be making some changes and maybe having them put a separate label on them so that we have a genuine expiration date on there too. Nancy says, can IC turn into neurogenic bladder? Well, neurogenic bladder really is about nerves that have been damaged and are dysfunctional. And so I think your question is a little bit off because we have to define what IC is first. And we have several variants of what IC could be. Hunner's lesions. Are Hunner's lesions known to turn into neurogenic bladder? I have no idea. I don't think so. I've never heard any of the doctors talking about it. Can a chemical injury to the bladder evolve into neurogenic bladder? Again, I haven't had anybody, or I haven't seen any study that suggests that. However, seriously, if you're pouring acid on a wound every day, that wound is certainly going to become massively inflamed, and eventually the nerves are going to become inflamed. And I don't know if there's some sort of nerve damaging effect that would occur over time. I think there easily could be. Pelvic floor driven, would that cause neurogenic bladder? No, it doesn't make any sense. Pudendal neuralgia, no, I wouldn't think so. Central sensitization, chronic overlapping pain conditions, which is central nervous system driven. It's a good question. I haven't seen any study that's ever suggested that, hon. I can see how nerves would become inflamed over time, potentially very seriously inflamed over time. But are the nerves actually damaged to the point that they can't function anymore? I don't know. I just don't know. Hi, Tracy. Jody says, I went 7 years before finally getting diagnosed with IC last month. I'm 30. It's been so hard. I used to use Azos so much. Yeah, honey, I know. Anne says, getting estrogen, will it help my bladder? Yes, it will help your bladder. Estrogen, your bladder relies on estrogen to produce that nice thick coating of mucus. The purpose of that mucus is to protect the walls of your bladder from any irritants in your urine, as well as any bacteria that could be floating in there. That we call it the mighty mucus for a reason. It's a really strong, robust coating of mucus that protects the tender urothelial cells in the bladder wall. Um, Unfortunately, that mucus is estrogen dependent. So when you're young and you have lots and lots of estrogen, you have lots and lots of mucus, and you can get away with stuff. When you're older, you have much less estrogen, much less mucus. Thus, your bladder's ability to defend itself is now compromised. That's not a disease process. That's called getting older. And so giving that skin topical estrogen is really, really helpful because that skin immediately starts to use that estrogen to produce more mucus. And we see that in many, many research studies, which show the skin responding very, very nicely to topical estrogen. So, yes, if you have dryness, estrogen atrophy, using some topical estrogen could be quite helpful. Lori said, you thought that's why they took pyridium off the market. I don't remember pyridium being taken off the market. Uh, Hold on. Well, pyridium plus might have been taken off the market. Hold on. Okay. So it looks like it was taken off the Canadian market. Hmm. Honestly, I just haven't paid that much attention to it, to be quite honest. It looks like insurance companies are dropping it. That's what they said. The FDA dropped it. Hmm. Well, you know what I'll do is I'll see if I can try to get some more information on that. Just got estrogen will help urgency frequency as your skin starts to incorporate some of that estrogen and rebuild some of that mucus that will protect the nerves that are driving the frequency urgency. So the answer is yes. Angel says, what's our contact number? Angel, just go to our website, icnetwork.org, and it's up on the top of the website. It's also on our Facebook page. Um, Heather says, I've had frequency, bladder sensitivity, minor pain for 2 months, trying to figure it out if this is my first IC flare, my new normal. Heather says, yes, pyridium was dropped in Canada, but you can get it by prescription now. Huh, interesting. Hmm. Anne says, what's the difference between bladder wall driven and pelvic floor driven? Symptoms that are coming from your bladder wall are called bladder driven. Symptoms that are coming from your pelvic floor are called pelvic floor driven, your pelvic floor muscles. They're very similar. They both cause frequency, urgency, pressure, pain, but there are some subtle differences. So as an example, bladder wall pain, it can be very sharp. It can feel like razor blades. It can be so sharp. I used to describe it as nails. It felt like it's witches' nails, long fingernails being driven down my bladder wall. That's what bladder wall pain felt like to me. Pelvic floor pain can cause this, pelvic floor muscles can cause the same frequency, urgency, but the pain tends to be duller, achier. It can have a burning quality to it, a pulling sensation, a pushing sensation. If you're having trouble starting your urine stream, then we're really going to be looking at your muscles being very, very tight. If you're having trouble having bowel movements, if sex is painful, we're going to be really looking at muscles. Jody said, I had a CAT scan with contrast and a cystoscopy. Okay, let's see. Judy says, I have a hard time urinating after pelvic floor therapy. It's painful. Is it spasms? Could be. I mean, I'm assuming that you eventually are able to urinate, maybe 10 minutes later, 20 minutes later, 30 minutes later. You certainly need to tell your pelvic floor physical therapist that you have a hard time urinating afterwards. Um, uh, I never did. I don't understand why that would happen, to be quite honest. Um, like for I mean, whenever I did pelvic floor physical therapy, it always helped me pee. And so I have to wonder if maybe they're being a little bit too aggressive, pushing you a little bit too hard, that's pushing you into pelvic floor spasm. Hmm. Make sure you tell your physical therapist. Lou says, you're breaking up terribly. Oh, that's not good. I'm just checking this computer here. Jennifer, I recently told you that I've gone without menstrual periods for at least 1.5 years, but then the other day I woke up thinking that I was having incontinence all of a sudden. And when I was able to get to the toilet, I realized that there was a lot of blood on your bladder control pad. Yikes. Hmm. Well, hopefully hopefully you're not still bleeding. I mean, was it just a normal period? I mean, I would assume that if you hadn't had a period for 18 months, that whatever your first period afterwards, probably going to be pretty heavy. Helen says, each time I connect with you on Facebook, it keeps cutting out. Is it your end or mine? My end looks good, but Helen, what you can do is come on over to our YouTube channel and watch it on YouTube instead. I broadcast YouTube on Comcast, and my Facebook feed is on AT&T. You're on completely separate internets. But Facebook is definitely a little bit more challenging these days. So Jennifer said that's continued for the past few days. Well, listen, if it doesn't stop after 7 days, you should definitely call your doctor. If there's anything weird about it, if you're passing really big blood clots, if you're having super pain, anything weird like that, please call your doctor and let them know. Hello, John from Wisconsin. Yeah, the bleeding is quite high. Well, again, Jennifer, I mean, you haven't had a period in 18 months, so there would potentially be quite a bit of endometrial tissue that would need to slough off in that first period, which would help us explain why you would be having a heavier period. But I think you should call your doctor and let them know if it's bright red blood, like seriously, like it's like you're bleeding profusely. I would call your doctor, maybe go to urgent care and just get checked out. Let's make sure nothing else is going on, hon. Tracy says, do I think SSRIs can cause IC? I've been on two for many years. I was in the process of transitioning down when, bam, I started with IC in May. Have been in daily pain since then, bedridden due to severe pain. I'm following the IC diet faithfully, taking hydroxyzine, Urabel, just had a hydrodistension and you're in physical therapy. So, Tracy, what did they find in your hydro? What did they find when they looked in your bladder? And what did the physical therapist find when you went in for pelvic floor physical therapy? Rima says, "How do you know if it's a bladder or pelvic flare? I got a UI with severe pain. I had been okay for 2 years. You do physical therapy before using diazepam and Urabel." Well, again, if you're if your day in this flare is completely controlled by volume, like even a tiny bit of urine in your bladder is painful, and you've got to run to the bathroom every 10 minutes. If you're running to the bathroom to reduce pain, that's kind of a sign that your bladder wall is part of the problem. Whereas with pelvic floor flare, it is it's not as intense. It's duller, it's achier, it has a burning quality to it, a vaginal burning sensation, a rectal burning sensation. And really, ultimately, can you release your urine right away, or do you hesitate 5, 10, 15, 20 seconds before you can release urine? If you're hesitating, then it's probably your muscles. But you can do both. If you don't know, you're going to have to do both. Maybe dilute your urine, um, alkalinize your urine a little bit, but at the same time, use a heating pad and let's see what we can do to get those muscles to relax too. Mrs. says, bladder rest or bladder builder for IC flares? My flares are driven by diet. However, I don't know what is flaring me anymore as I barely eat and watch what I eat. I've been off and on a flare since April. Well, bladder, none of the supplements, with the exception of Allopath, are designed for instantaneous relief. I mean, they work over time by giving your body some chondroitin to build up a bladder, to help try to build up a protective barrier in your bladder, combined with quercetin, which is an antihistamine, combined with PEA for pain relief, etc. What might help a little bit more with a flare is Allopath. Allopath gives you the soothing effect of aloe with some PEA for pain relief. So if I had to pick anything for, an immediate bladder wall flare, it would probably be some Allopath on top of that. Brooke says, I feel like there's a fire in my bladder. So Brooke, um, uh, where is it burning, my dear? Where is it burning? Is it burning inside of your body or on the outside of your body on your skin? Does your urine feel so hot that as you're trying to urinate, it feels like it's burning your skin terribly? If the burning is on the outside or even in your urethra, then that's probably estrogen atrophy. That's when your urine feels really hot, feels like it's really burning you. And it's not burning you. It just means your skin is dry and can't protect itself quite so much. We call that urine burn. And that's just one of the early signs of uh, perimenopause, menopause, postmenopause for those of us. So Jessica says, I've been flaring badly since my COVID shot. Is that normal? So Jessica, this has been the question of questions for the last, 10 months since the vaccines have been out. And the answer is that I believe, that I don't have the research study to support this, but I believe that about 5 to 10% of IC patients who have the vaccine flare, because this question has come up so many times. But that said, like I had the Pfizer vaccine, I did not flare at all. The great majority of patients are not flaring, but there is a small subset of patients who do appear to be flaring, but it appears to be a very short flare, a couple week flare. So right now, the American Urology Association meeting is happening virtually. It was scheduled for Las Vegas, but because of COVID, they switched it over to a virtual meeting. And I watched one of the press briefings yesterday, and it was about COVID-associated cystitis, and it's quite interesting. That it was actually in Detroit, in Michigan. A year ago, Detroit was one of the leading center for COVID infections. There were massive COVID infections in the Detroit area, and so the doctors who were caring for those COVID patients started noticing what they call de novo cystitis symptoms. These were in patients with no history of any sort of bladder issues who all of a sudden, because of COVID, they ended up with what feels like IC, intense frequency, urgency, in some cases pain, et cetera, et cetera. And they started talking with other clinicians in the area and clinicians around the country, and they started to realize that this is real. They're calling it COVID-associated cystitis. That a number of patients who get COVID are ending up with pretty severe bladder symptoms. And so, to try to study that more, they started collecting the urine of COVID patients. Again, in Michigan, this was done at Beaumont Health and at a university in Detroit, the Detroit something something something. Don't quite remember the name of it. As well as a couple of other clinics. So they started gathering the urine of patients with this COVID-associated cystitis to try to understand it. And the good news is that they did not find active virus in most of them, not all of them, most of them. What they did find was extremely high cytokines. Cytokines are inflammatory markers, and we know that we believe that the reason why there are so many patients who become so incredibly ill, if not die from COVID, is because they're having something called the cytokine storm, where their body is producing this massive inflammatory response, and that inflammation is quite damaging and destructive to tissues. And so what they were finding is the cytokine, high levels of cytokines in the urine of these patients, which means that the damage of these inflammatory markers was also happening in the urinary tract. And they have proposed that this actually be a test or marker for how advanced somebody's COVID could be. And they were encouraging more research on it, because maybe by doing a simple urine test, they would be able to tell if somebody is in or developing that intense cytokine storm, which is so incredibly damaging. So that was Michael Chancellor. And I will do another article on it when I have a chance to. I watched it yesterday. 10-day flare after the booster shot. I have no information on the booster shot and how that would affect IC at all. Tracy's mentioning glomerations. Glomerations are no longer considered particularly meaningful in IC. That the test itself, the hydrodistension can cause those petechial hemorrhages, glomerations, which 30 years ago we thought was IC. Now we know that when you stretch the bladder, that's what happens. You get petechial hemorrhaging. And so glomerations are no longer required for a diagnosis of IC, nor are they looked for. They're considered pretty much meaningless. Jessica says, I've been running to the bathroom all day. I know that mine is flaring. I don't know what I can do. I want to take hydroxyzine during the day, but it's only used at nighttime. You can take hydroxyzine during the day as long as you're not driving anywhere. It's just going to knock you out and make you sleep. Some patients with some more severe IC are actually given hydroxyzine to take in the morning and in the evening. But again, it can be quite sedating. Jessica, you got to be doing, I mean, you just got to buckle down here. Anybody in a wicked flare, this is about going right back to the basics. Got to drink water. dilute your urine, not a massive amount, but let's get that water in there. Use your heating pad to try to relax any muscles you've got. If you need to alkalinize your urine, you can use a Tums, you can use Pre-Leaf, you can use maybe a quarter teaspoon of baking soda in a glass of water, half teaspoon at the most. I had a patient call this week who was doing a tablespoon. It's like, honey, you can't do that because of sodium. It will raise your heart rate. And she was like, oh my God, and I already have heart problems. Right. It's like a quarter teaspoon or at the most a half a teaspoon in a big glass of water. Right. So alkalinize your urine. If you've got some, pain medication, maybe this is the time to use that pain medication. Rima says, I don't have urgency to urinate. Your pain comes after voiding. I can void easily. Well, Rima, where is your pain located, hon? Where is it? Is it in your urethra? Is it in your rectum? Is it by your perineum? Where is your pain? And Jessica's talking about Cipro, and yes, ciprofloxacin actually is no longer recommended for simple urinary tract infections. It can cause very severe side effects, including aortic aneurysm. The FDA says that the risks of Cipro far outweigh any potential benefits, and it should no longer be used for simple UTI. The only context that Cipro is used in now is if you have a very severe infection and testing has proven that Cipro is maybe the only antibiotic or one of a few antibiotics that will kill it. So we don't normally take Cipro, unlike 20 years ago where everybody was given Cipro. Mary says, why would I be in a constant flare? Well, I mean that it either means that something is massively tweaking your bladder or your pelvic floor. Something's happening. I'm kind of weird today. I haven't slept well this week. It's been a long week. Angel says, what if you bleed and you've had a what what wait, what? Angel, what if you bleed and you've had a full hysterectomy? Where are you bleeding from, hon? Are you bleeding through your vagina? Are you bleeding in your bladder? Are you passing blood clots? Peony says, my uterus has retroverted and could this be causing my flare? Easily. Easily. Joni says, hi, Jill. Hi, Joni. Nice to see you. So I did so Peony, about a month ago, I did a story of a woman who had a retroverted uterus. So she had severe Hunner's lesions. She had a severe cystocele rectocele. And when they went in to repair the cystocele rectocele, what they found was that one of her ligaments had broken. And so her uterus did exactly what yours did. It spun and faced backwards. And when they repaired that ligament and got the uterus in the right position, it was stunning how much better she was. Not only did her bladder symptoms calm down, but she had Hunner's lesions and they disappeared. It was a case study published, and I think it's called posterior fornix syndrome. It cured her Hunner's lesions. So going over to our website, icnetwork.org, and read that. And the title is something like woman miraculously cured of lesions with bladder suspension surgery. Peony says, doctors won't help me and I don't know what to do. No, you're not seeing the right doctor, hon. If your uterus has rotated out of position and is now backwards, it would be a urogynecologist or a gynecologist who would do that. Where do you live, hon? Where do you live? Florida. Florida is tough. Florida's tough. We do have the Cleveland Clinic in Florida. You could potentially go there. There's a wonderful support group in South Miami if you're down by Miami, who might be able to direct you to somebody who might be able to help you. I also have a database that I can look stuff up on, and I would encourage you to print out the article that we just wrote on that with the case study. Angel, if you're in Flint, Michigan, you've got one of the best doctors in the world down at Beaumont Health in Royal Oak, Michigan. That's where we usually refer everybody. Ken Peters. Your OBGYN said a uterus is normal? What? What? No, no, it's not normal. That sounds like an OBGYN who just doesn't want to do anything. I think it's time for a second opinion, that's for sure. Peony, and it's always been antiverted. I mean, have you had surgery? Have they gone in and looked at it? Have they looked at the ligaments? Have they looked at anything like that? Hmm. John said, "Is it possible that a different virus could cause IC?" Hun, you know what? The viral tests are now really, really good. The whole next generation tests that are used to identify polyoma BK in the bladder, HPV, herpes, a couple of other viruses that have been associated with the bladder, as well as potentially COVID infecting the bladder. I would think that they would have made that connection if there were any other viruses, but this is a very dynamic environment, and the more we learn, the more questions we have. And the good news now is at least they're looking for more viral infections. So Jessica is asking about the baking soda. Well, honey, since you have high blood pressure, baking soda is probably not as good of an idea for you. Do you have any Tums or Pre-Leaf? That's what I would do instead. Tums is calcium, so why not some Tums? Mary says, "I don't even know what a flare is. You've been 2 years constantly in a flare. Is everyone okay? Generally just when they flare." Well, as patients get better, they go from having symptoms every day to having more sporadic symptoms to then having symptoms, being okay for weeks and weeks, and then they get a flare. And that really fits this injury model that we're doing so well with, that the bladder can heal over time. But if you're doing something to irritate your bladder every single day, like drinking coffee or soda, then you could be in a flare every day. Um, uh, I attended a class that taught by Dr. Anthony Schaefer at one of the National Institutes of Health IC meetings, and he was talking specifically about bladder healing, and that the bladder is the slowest healing organ in the body, and it takes 2 weeks for one of the big urothelial cells to be replaced by a little tiny stem cell. Then it takes 2 weeks for that cell to grow, expand, change shapes, and fill in for the cell that's damaged. And what he said is that new fragile cell is exquisitely vulnerable to acid. That literally 1 cup of coffee a day is going to destroy the next generation of cells trying to repair your bladder. And so the consensus was the patients who suffer the worst are the patients who drink 1 cup of coffee a day. You're going, well, it's 1 cup, it's not a problem, but you're not understanding the physical damage that acid in the acid in the coffee is doing to the next generation of cells in your bladder. And I remember we all looked at each other and we all went, yeah, in our experience, the patients who suffer the most by far, the patients who just do one soda or 1 coffee a day. Mm. So Angel, I mean, Ken Peters, Beaumont Health, that's where I would go. Gwen says, I'm supposed to have my cystoscopy on the 27th. I can't get pain management anywhere, even. Well, honey, if it's a plain cystoscopy done in the doctor's office, it's literally a 5-minute test. I call it a looky-loo. And all they're going to do is look, they're going to numb your urethra, stick a scope in, take a quick look around, pull it out, you're done. That can easily be done in the doctor's office. The challenge with that test is that your urethra is going to be pretty pissed off for a day or two because they have stretched your urethra. But if they're doing a hydrodistension with cystoscopy and or potentially a biopsy, then that's the test where, I mean, some people walk out of that hospital and they can go out to dinner. Other people walk out of the hospital and they're in bed for a week. It depends upon how it's done. And in the old days, they used what we call high pressure long duration tests, which were really traumatic to the bladder. But now they're not supposed to do that. They do low pressure short duration tests to minimize trauma on the bladder. So ask for that. Ask them how they're going to do it. It should be low pressure short duration that should dramatically reduce any pain you have. I mean, I had it done 4 years ago, and I don't remember suffering with any significant pain afterwards, although granted, I had my hysterectomy that day too. Gwen said, I'm confused about something. One doctor said possible Hunter's lesions, but you said they can't be seen with normal cysto. I'm doing it in the office awake. Don't think they're doing a hydrodistension. There is a specific type of cystoscope called narrowband imaging that they can do in the doctor's office that will find lesions. So Gwen, it may be that your doctor has a narrowband imaging cystoscope that can do that. But you need to clarify. I mean, I had a patient call last week who had a hydrodistension with biopsy in the office with no anesthesia, and I was stunned for her. I was stunned. No, that actually she didn't call me. She was in the meeting we did. She was on Facebook. She was in the meeting that we did on Thursday. And I was appalled. Anytime you stretch the bladder, it has the potential of hurting tremendously. It should always be done under anesthesia. And I believe that that's what the AUA guidelines say. I know that there are some doctors who say they can do it in their office, but I would never, ever agree to have a hydrodistension in a doctor's office without anesthesia. I told that story. I had a hydrodistension by accident when a radiologist was doing a voiding cystogram. I brought the note from my urologist because I walked in and I saw a 1,000 cc bag of fluid hanging from an IV stand next to the bed, right? And I saw that and I was like, oh shit. And I handed her the letter from my urologist, which said, do not fill her bladder more than 400 cc's. She refused to read it. She said, I know what I'm doing. I don't need to read that. And I'm just like going, oh my God. So I let her do it. And I'm laying there and I'm looking at the bag and I'm feeling my bladder going, oh my God, stop. She put 1,000 cc's, almost 1,000 cc's of fluid in my bladder. And I was a screaming lunatic. I was agony. And I got her fired. She deserved to be fired for that. And it was because, so what happened is I walked out and I was shaking, sobbing. My mother was waiting for me in the waiting room. I was just stumbling. It was so bad. And like the very next day, Kaiser Permanente sent me an evaluation form for another doctor's appointment. And I switched it over to this appointment. And I wrote exactly what happened to me. And I mean, I just let it all out. And the head of the department called me within a week and profusely apologized. And she got fired because she refused to read the comments provided by the urologist who had referred me for that test. She deserved it. You know what, guys? One of my quotes is, "Be bold, and mighty forces shall come to thy aid." Listen, if you've been damaged or abused in some way, you have the right to complain. And it's important to complain because we want to make life better for the next generation of patients, right? If we have somebody who's genuinely abusing patients in one way or the other, we need to try to make that better. We need to let somebody know that this has happened. And so whether it's calling the chief of the department, sending them a letter, going to the medical board, whatever, depending upon what's happened, if it's really, really severe. I would have gone to the medical board, but they were over the top apologetic to me, over the top apologetic. And so I did not do that. Gwen saying in the 90s, they dilated my urethra, but I'm menopausal now. I'm 100% more pain down there. Well, honey, that's what they did in the 90s. That's what they did in the 70s. I had about 100 urethral dilations in junior high and high school. But now we know to ask a very, very important question, and that is, why is the urethra narrow? Back then, they didn't necessarily ask that question. They were just like, all right, well, let's just stick a metal rod in there and stretch the urethra. That's called a urethral dilation. Today, we now have a much better idea as to why that happens, and that's because of tight levator ani muscles. And so you don't see urethral dilations done very much anymore, which is a great thing because now instead we can get to the root cause of the problem, which is something wrong with the levator ani muscles. Mary says, I don't even know what a flare is. You've been in constant flare for 2 years. Everyone okay? Okay. Honey, let's see if we can. I mean, listen, if you have been in consistent pain for 2 years and you have not had any response to any of the treatments they've done for you, and or you're getting worse rather than better, the American Urology Association says, all right, stop, take a step back, let's revisit this diagnosis and make sure we know what the hell we're treating. Because if bladder therapies are not working for you, then maybe it's not your bladder wall. Maybe it's your pelvic floor. Maybe it's a fibroid tumor pushing on your bladder. Maybe it's endometriosis on your bladder. Maybe it's a messed up tailbone that's putting pressure on your pelvic floor, right? And so today, remember, we don't think of IC as an incurable bladder disease anymore as much as we think of IC as a pelvic pain syndrome. Why? Because structures beyond the bladder are usually involved. Usually involved. Pelvic floor is the very, very first thing we're going to look at, especially in men. Is Fiji water a good one? Not to, yeah, Fiji water is fairly popular. I mean, any good spring water should be fine. Just not, you don't want to do distilled water because there's no pH balancing minerals in there. You want to stick with the spring water. Thank you, Sylviane. Donna says, my pain. Okay. All right. So this is interesting. Donna says, my pain is I feel like I have to empty my bladder really, really bad, but nothing comes out. It's like I have a bladder infection. I feel like this all the time unless I'm on gabapentin or an overactive bladder medication. So what would you say my type is? So um there is a point in bladder irritation when um, you get what we call a false sense of fullness, where you feel desperately full. I was like, oh my God, it hurts so bad. Where is the bathroom? But when you go to the bathroom, nothing comes out. Nothing comes out. Somebody's calling me. Okay. So that false sense of fullness is generally that's when the bladder is profoundly and badly damaged. Um, so let me describe a flare. Let me describe the early flares that I had when my bladder wall was part of my problem. My bladder wall's healed now, but back then it wasn't. Okay. So you go to bed at 10, and of course you pee before you go to bed. And you wake up an hour later and your bladder feels really full, and you go to the bathroom and you pee out maybe a quarter cup. You go back to bed. You wake up 30 minutes later. Your bladder feels very, very full. You go to the bathroom, you pee out a teaspoon. You go back to bed. You're lucky to fall asleep. 15 minutes later, 20 minutes later, you got this overwhelming sense of, oh my God, my bladder is so full. I have got to go pee. You go to the bathroom and you get a drop or two. And then you start straining, which is always bad. When you strain, you might get a couple of more drops. And that's where you are for the rest of the night. It's like, oh my God, my bladder feels so full, but there's nothing there. And that's the reality, is that is this false sense of fullness is kind of like your bladder. I mean, not to I mean, not to, I the way I interpreted that when it was happening to me is this, it was kind of like my bladder was screaming for help. Okay. It's just really, really inflamed and irritated. And so that's concept number one, is this false sense of fullness. So when do we normally see this? We see this in the coffee drinkers, in the soda drinkers, in the people doing diet soda every day, that there is something every single day that is provoking the bladder wall so badly that it's now kind of doing the equivalent of screaming. Um, the other time where we might see that is with um, a really bad pelvic floor spasm, where you really feel like you need to pee, but your muscles are so tight you just can't relax enough to let your urine out. The thing about the pelvic floor spasm, though, is they usually pass, 20, 30 minutes, an hour, that the muscles will kind of come out of spasm a little bit. And you'll be, I mean, like, have you ever had like really, really bad IBS diarrhea? Like you're on the toilet and you're like going, oh my God. And you are empty. Like you are empty. And you notice you can't pee right away? That's happened to me a couple of times. And that's just because everything's a spasm right now, and you have to get up, go walk around for 15, 20 minutes, wait for things to calm down, and then you find that you can release urine a little bit more. So those would be the two things that I would look at, but I think you should tell your doctor about that too. Joan says, I used to be on Cipro all the time. Now you have an aorta aneurysm. I would not take it unless, Joan, I'm so sorry, honey. Mary says, it's my 1 cup, I think. Hey, girl, you got to lose it. Yes, 1 cup of coffee can do it. 1 cup of coffee a day can do it. It can cause profound damage over time to the cells that are trying to repair your bladder wall. I know, I know. And even though she says, but I gave it up for months, but you didn't see a big change. Your job is to create an environment that will support the healing of your tissue down there, whether it's your bladder wall or your pelvic floor. And even if you couldn't sense it, you have to ask yourself, if I had a wound on my hand, would I pour coffee on it? No. And what would happen if you poured coffee on a wound every day? The wound would get bigger. The wound would get redder and redder, and then it would start getting bigger and bigger and bigger. Until you might have started with a small wound that's now, covering a much bigger area, just from the irritation of that chemical over time on that wound. I didn't drink, I'm going to say in 20 years, I've had 3 sodas. In 20 years, I've just had 3 sodas. My pain was so severe when I first started. I would have done anything, anything to not be in that pain. So giving up the soda was a no-brainer. It's like, I got no problem with that. And the same with the coffee. I didn't drink coffee for probably 15 years. And then as things healed, I was able to do an occasional cup of decaf, but I wasn't doing it every day regularly until last year. Last year, with COVID and with the fires, I started drinking Frappuccino every day, decaf, and I've done that like 3 times in the last 10 years, where I'll do it for a couple of months. And what I say to my doctor is, it's just like slowly all the nerves in my body get turned on when I do that. And this last time they got turned on so badly, my heart was going crazy. And the doctor at the emergency room looked at me deadpan, like, you may never drink coffee again, ever. After me having terrible heart problems for 5 hours. It's never, Jill, never, which is why I now drink Dandy Blend herbal coffee, and I make my Frappuccinos from that. No acid, there's no real coffee in it, and it works fine. Gwen said, what's the name of the coffee that you use? Okay, so I don't drink any type of regular coffee anymore, and I haven't since last November. I drink Dandy Blend herbal coffee, which is roasted chicory, etc., and I just love it, and it works fine. There's no acid in it. We do have some low acid coffees in our store. We've got Bella Rosa, Simpatico, and Tyler's coffee. Bella Rosa is, in my opinion, the best low acid coffee in the market, simply because it has the lowest levels of chlorogenic acid, and the chlorogenic acid is what can irritate your bladder wall profoundly. The nice thing about the Bella Rosa is it has full calf, half calf, and decaf. So if you are trying to get off the caffeine, you can go to their half calf for a while. And then you can go to decaf. I'm going to sneeze here. Gwen said it's a Dandy Blend on our website. I reordered it 2 weeks ago, so it should be in. Heather said, what was the cause of your bladder wall irritation? What did you do to heal it? So, okay. So I am IC subtype 5, chronic overlapping pain conditions, combined with IC subtype 3, pelvic floor. So this is what happened to me in a nutshell. Okay, in 7th grade, I couldn't sit through class. I had to pee all the time. And the teachers complained, it humiliated me. We go to the doctor. The doctor goes, you have a urethral stricture. You have a urethral stricture. They dilated me, like I said, about 100 times over 3 to 4 year period. And of course, now we know that it was muscles. Yes, Sierra, we sell these all in our store. Then in high school and junior college, I developed vulvodynia and extreme pain on my perineum. I mean, it felt like it had been scrubbed off with sandpaper. And I'd be going to my OBGYN, Dr. John Renfrey. I loved him. I went to school with his daughter, Colleen. And he's like, Jill, you look fine down here. I don't understand why. You have the most sensitive skin I've ever seen. Right? Okay. Then in college, I developed polycystic ovarian syndrome. And I threw a bunch of ovarian cysts. I missed finals. I had to fly home. They had to decide if I was going to do surgery, which they did not do. Then after that, in my first job, I developed irritable bowel syndrome. I ended up on the floor in the fetal position of the federal building in San Rafael, California, because I'd eaten a freaking chocolate oatmeal cookie for my snack at 10 in the morning. Okay. Then after that, I developed migraines for only 6 months. Praise God. Hallelujah. Then I developed all these crazy sensitivities, these really weird sense of smell. And then these food sensitivities. Oatmeal is one of the things I'm extremely sensitive to. I don't eat oatmeal anymore. And then was in grad. I got through grad school, dealing with the IBS, dealing with all that. Um, Things calmed down, and I started swimming a lot because I was an athlete. And I trained in a pool that had made a terrible mistake with their pool chemicals. And I got a chemical burn in my bladder. That was my first diagnosis. I had never had bladder pain up to this point. I had had frequency urgency, but I had never had bladder pain until the night I swam in this pool. And the pool later admitted, I called the pool the next morning. I was up all night, thought I had a really bad UTI. Said, hey, is anything happening with the pool? He goes, why? I said, I swam yesterday. He stopped me. He goes, what? Wasn't the clothes sign up? I went, no, a bunch of us swam. He goes, we bombed the pool yesterday. And then he goes, oh, you know what? That's why we've had people complain. Other people had issues too, not just me. So my first diagnosis was chemocystitis, a chemocystitis, chemical burn. But I didn't know about diet for a year. What was I doing? I drank a quart of cranberry juice a day. Because it's what we were all trained on. We were all trained to drink cranberry juice. Like, I want to get better. I didn't understand that it was injury. I was still, in my brain, I was thinking disease, disease, disease. And that cranberry would help any bladder disease. And so I am not lying. I had a quart of cranberry juice on my desk every single day at work, and I drank the whole thing for a year. And what happened is the pain got worse and worse and worse and worse because, hello, the acid of the cranberry was just destroying any of, here, I mean, I already had a chemical burn, a physical chemical burn in my ureters, in my bladder, in my urethra from the chemicals. And then I was pouring acid on it every day. And so at the end of that year, I was a lunatic in pain. I was at the emergency room a couple days in a row. I had a doctor say to me, this is your life. You will forever be in pain. Get used to it. You will forever be a burden on your family. And I've told that story before. And that was the moment that woke me up. And that's the moment that I started fighting. So I absolutely had a very severe bladder injury. And ironically, I couldn't sue because none of the research showed that pool chemicals could do this until 2 years ago when the Center for Disease Control finally issued their pool chemical report. And this has happened to thousands of people. And I'd worked with about 50 of them. I worked with a swim coach at UC Berkeley that this had happened to. Another lady who had gotten a brand new hot tub, and they installed it, filled it with water, put the pool chemicals in it. She said, can I get it? She asked them, can I get into it? They went, sure. She got into it. And that's exactly when her icy symptoms began. She had the same chemical injury. You're supposed to wait 24 to 48 hours after you put the pool chemicals in. Okay. So in 1993, when I was referred to UC San Francisco, and that was my second year into this, I did the nerve stimulation, the ankle stim, the urgent PC that we now know as urgent PC. And that's the first thing that started turning my pain off. I was in agonizing pain every single day for almost 2 years. There was never a moment of relief all night long. I was exhausted. My family was exhausted. We just didn't know what to do. Like I said, I would usually sleep on my living room floor. I never flushed the toilet. I didn't want to wake them up. I would flush it in the morning, because I was in there every 15 minutes. It took about 5 years for my bladder to heal from that. And my bladder is now completely healed from that. Healing is always happening. The challenge is that I was doing a lot of stuff that was making that injury worse, like drinking cranberry juice and drinking soda. One of the worst flares I had, I was out with my boyfriend Todd at the time. We went to a new Harrison Ford movie. I got a 7-Up, a fountain 7-Up. Oh my God. I was sobbing in the car driving home. It was so bad. So any damage that happened to my bladder back then is long healed. And we looked at my bladder a couple years ago, and my bladder is a baby bladder. There's nothing physically wrong with my bladder. Fundamentally, though, my subtype is chronic overlapping pain conditions and pelvic floor driven. So if we go back in time to what happened when I was in 7th grade and got these symptoms, broke my tailbone. I broke my tailbone that year. And it never got treated because I could move my freaking tailbone around with my finger for about a year. It's disgusting, but I remember doing it. And so I truly believe that aside from the natural sensitivity I inherited as a redhead, that my issues all began with that tailbone injury that messed my muscles up, that caused this ripple effect, and then my central nervous system got involved, and the rest is history. When you're in that level of pain, it changes you. It, you know, um, the things you thought were important are not important. The fancy car, the fancy job, the fancy clothes, none of that becomes important. What's important is having somebody at your side. None of that it changed me profoundly. I could care less about a fancy meal. It's the last thing I want. I'm the easiest date in the world. You know what? Let's go get sandwiches and go sit by the lake. I do not need anything fancy. I just want somebody with me. And it creates a great foundation for reminding you what's important in your life, because money doesn't make you happy, although it's certainly helpful. It's about the relationships and the people in your life. And I've had some very, very good relationships over time, and people that I know that I can count on, right? So don't let IC and this pain put a barrier between you and your friends. Because here's the deal. You almost become a better person because of this, because now you will never ever ever walk away from somebody in pain anymore, because you know what it's like to suffer alone. That makes you a better friend, that makes you a better wife or husband, that makes you a better mother or father, right? So about 5 years to heal my bladder from the chemical burn. And now, really, I mean, I don't have symptoms every day anymore. My symptoms are really dominantly just based upon the health of my pelvic floor. And that's something I have to work on constantly. And sitting does not help. Rima says, I'm seeing Dr. Ken next month. He will be able to tell. Awesome. Yeah, he will. He's a master diagnostician. It's not Dr. Kenny, it's Dr. Ken Peters. Candace says, what's the name of the book we just released? I need to get it. Let me get it. IC 101. It's not just a bladder disease. IC 101. It's not just a bladder disease. And this book talks about the subtyping more. And we're getting some really nice reviews. For anybody who's watching this, who's already read it, would you please go give us a review on Amazon? And let other people know. I've gotten some beautiful, beautiful reviews on this. I know it's not going to work for everybody, and that's fine. I got a review from somebody who said, destined to gather dust in my bookcase for the rest of my life. My answer back is, well, send it back and I'll give you a refund. But I truly believe it's going to help. It is already helping people. What are you guys doing here? Gwen, I will email you the book. Send me an email and I will email you a free copy of the book. Okay, honey? You have my email address. Email me and I will send you the book. Guys, y'all know I'm a softie, right? All right, what's going on with Facebook here? Ariana's saying, "Oh, Candace, thank you." She says, "You're my hero." Matt says, "Good evening. I can't tell the difference if I have to pee a lot or a little. It's the same sensation." Well, I guess, Matt, is it painful? There's normal urgency, which we would normally feel when there's a certain amount of urine in our bladder, and our bladder tells your brain, "Hey, I'm getting full," and your brain says, "All right, then you need to go find a bathroom and pee." That does not hurt. That should never hurt. But if urination is also involving discomfort, intense discomfort, then that tells us that something else might be going on. Ariana says, "How do you feel about alkaline water, and what do you do? How do you feel about D-mannose?" I'm not a fan of alkaline water. I'm a chemist. My first degree is actually I have two chemistry degrees, one in chemistry and the other one in pharmacology drug development. And in my chemical safety class that I took in my first year, the professor was hysterical, or the lab manager. Well, no, it would have been the professor who said, "Thank you, Dad." This is my 98-year-old dad who's wearing his pajamas, so he can't say anything. Are you going to put your clothes on? He's 98. He can be in pajamas all day if he wants. All right. So getting back to alkalinity. So you have to understand there's something called acidity and alkalinity, right? So acidity has a very low pH. Alkalinity has a very high pH. They're both potentially damaging. So what this chem professor said is bleach will eat your eyeballs out just as quickly as sulfuric acid. It's a direct quote. I've said that. I mean, this was 30 years ago. So we know if we splash sulfuric acid in our eyes, that the sulfuric acid is probably going to blind us. And you see that in the Middle East with people who have acid thrown on their face and disfigured, and it's just disgraceful. But have you ever spilled bleach on your hand? If you've ever spilled bleach on your hand, it gets very slippery. Why? Because it's dissolving the cells. Your natural pH is going to be between be 5 point something to 6 point something, slightly acidic. If you're pushing your pH up higher in your urine, you're running the risk of the alkalinity damaging your bladder, just as if the acid would damage your bladder. The one time I was at a food show and I tried some alkaline water. What shocked me is that it took all the mucus out of my mouth. I had the worst dry mouth after drinking this alkaline water, and that just made no sense to me. We need that moisture. D-mannose is a potential preventative if you are prone to E. coli-based bladder infections. Mannose is a sugar that the human body does not use. When you take it, you pee it out, and it has a receptor that's the same size as an E. coli receptor. They attach in urine, and you end up peeing it out. So if you're struggling with recurring UTIs because of estrogen atrophy, D-mannose might be real, or a PAC product, proanthocyanidin product like Prevent, might be helpful too. Where is it? Here it is. PRBNT, Prevent. I'm being very casual here today. I didn't like the idea of wearing overalls, but I don't care because I'm tired and it's been a long week. And I hope y'all know that I'm just kind of fried right now and casual right now. I'm doing my best, but I'm not perfect today, but in any shape or form. Tracy said it'd be nice for you to be our doctor. I didn't go to medical school. I could have. I have a pre-med degree, and and I have a surgical internship. And the reason why I didn't go to med school was because I was not confident in my dilutions in doing anesthesia, because I had an opportunity in my surgical internship with my pharmacology degree to not only be the surgeon, and it turned out that was really cool, and I was actually pretty good at that part. What I wasn't good at was the numbers, and it was not intuitive to me. I felt that you have to be naturally intuitive with numbers. And so I made the decision not to go to med school. And I just had the doctor from Harvard just, she said, "Why didn't you go to med school, Jill?" And it's like, I told her, that's what I told her. And she went, "Jill, they would have helped you." My lab partner went to med school. She was wonderful. She's a wonderful doctor. But, God has a plan. Sometimes we don't understand it, but I do believe that there's a plan. April, thank you so much for the stars. I really appreciate it. 2 weeks in a row. Thank you, hun. Linda says, green tea is bad. Oh, honey, green tea is almost worse than a cup of coffee. Green tea is terrible. It's not only extremely acidic, but it's also caffeinated. Green tea is just right up there. So all those diet green tea products, man, do not do them. Do not do them. Matt says, anybody from Canada? I'm in Halifax, Nova Scotia. Candace says, I cringe when I think about how many times I thought of cranberry juice was a cure. I know, right? I mean, like, seriously, we should all had stock in ocean spray because we all believed it. We drank quarts and quarts and quarts, gallons. Candace said, I also had a doctor tell me, get used to it. You'll be in pain your whole life. You'll be on medication your whole life. Very devastating. What a crappy approach. It's like you are already very vulnerable and physically traumatized, and then they traumatize you and more emotional. I'm so thankful for this community. Hun, I mean, like, it shocked me. It shocked me when that doctor said I would forever be a burden on my family. And I needed that, because that's when I got angry for the first time. I was feeling sorry for myself for 2 years, as anybody would, in pain. But that was the moment that I went, I will prove you wrong, you son of a bitch. How dare you say that to me? And that's when I went home and I started studying. I started reading everything. And I joined the ICA, and I became a support group leader for the ICA for 2 years. And then started the IC network. And now we're 28 years into that. And you know what? He was wrong, because I haven't had severe pain. I have not had severe pain for 15 plus years. My bladder has healed. My muscles are another story. They're tweaked because I have a bad SI joint, but my bladder itself is in very, very good shape right now. Becky says, I was drinking 100% cranberry juice from a health food store at first. Yeah, made your IC so much worse. Yeah. Thank you, hun. Thank you, Candace. Becky says, I was just diagnosed less than a week ago. There's so much to take in and learn. I feel so overwhelmed. You know what, Becky? I understand that. The single most important thing you have to understand as a newly diagnosed IC patient is that IC is a grab bag diagnosis. And what that means is that a doctor will often tell you you have IC if they just don't understand what else is causing your symptoms. Presumably, they've already ruled out infection, and you're still up at night, you're still peeing all the time. That's when they go, oh, you might have interstitial cystitis, especially if you have pain. But we no longer think of IC as a bladder pain condition. We think of IC as a chronic pelvic pain syndrome, because now we know that structures outside of the bladder can victimize the bladder and cause these symptoms. You have to understand, let me get my model here. All All right, let us ponder. Let us ponder the pelvis here for a moment. I'm going to pull out the bits for a moment. All right. So let us look at this marvelous structure in your pelvis. So this is your pelvic cavity is the center, it's the core of the human body. It carries the weight of your torso by these big giant bones. The bigger the bone, the more weight it's meant to carry. Your hip bones are your biggest bones in the human body. So we know that your hip bones are designed to carry the weight of your torso, but it also absorbs the stresses that come up from your legs. Because if we were to look at muscles, the muscles in your lower back and your back come down and attach down into your pelvis, just as the muscles in your legs come up and also attach in your pelvis. So the other big thing you've got to understand about the pelvic cavity is that it has a lot of skeletal muscles, which connects the torso to your hips and your legs to your hips and tailbone and stuff like that. The pelvic floor muscles are hidden inside the pelvis for the most part. They're protected by bony structures more than anything else. And they also tend to be flat. You can see, if you look here, you can see that they tend to be flat along the bone, right? But your pelvic floor muscles are what helps you move your leg like this, right? Those are your pelvic floor muscles making that move. Okay. So we know we've got important muscles in here. We know that we've got really important blood vessels in here, like your aorta, and all the blood vessels that come down here and go down into your legs. We know that we have nerves that come off of your spinal cord. If you look at the holes in your sacrum here, nerves emerge from that. Your pudendal nerve emerges in that. They come into the pelvic cavity, et cetera, et cetera. But here's the other thing, is that this is really crowded space. So let me put on the lowest, I have to put on the lowest level of muscles, which are your levator muscles. Now let's just look at these muscles here for a moment. These are the muscles that have a very unique role in the human body because they are also heavily involved in urination, defecation, and sex. They are the only major muscle group in the human body that have such a strong influence over other essential functions. Why? Because they have holes in them. So we can see the urethra right here. This is obviously a female model. We can see the vagina here, and we can see the rectum here. Now, imagine what would happen if these muscles are tight. If these muscles are tight, it's going to squeeze the urethra. If you ever feel like you're peeing through a needle and your stream is really narrow, that's because your levator muscles are tight. That's the more common cause. There could be some other things, but that's a more common cause. If you're struggling with constipation, or you're having trouble pushing to have a bowel movement, or you're feeling like you have to push even though you shouldn't be pushing, that could be tension in these muscles right here, levator muscles. And of course, if you're a woman and you've got tight muscles, putting a penis in here is hard because it's tight. It's a condition called vaginismus. If you're somebody who you've dreaded sex has never been comfortable for you, or you dread going to the OBGYN because when they put that speculum in there, it's going to hurt like hell. Odds are you have vaginismus. You probably had vaginismus your whole life, probably from something like a bike injury when you were 4 or 5 years old. Of course, there could be birth defects too, but some women have gone into pelvic tension in childhood. I mean, it's real. It happened. These muscles can play a profound role in our health. But now let's look at this. Okay, so now I've got the levator muscles in, and you can see that there's some holes in there. So the first thing we're going to do is we're going to attach the vagina and the uterus. Look at that. It's already taken a lot of space. Get in there. Okay, now we're going to put the bladder in. And you can see, although that's not as low as it should be, when I ask you where your pain is it centered or is it to the left of center or right to center? And you know, so many of you, well, I'm wearing the wrong things right now. Okay, so if you have pain, so here's my, oh darn it, I'm so wearing the wrong clothes for this. Okay, belly button, pubic bone, straight line, top to bottom. So if you have pain right over your pubic bone, that's your bladder. But if you have pain over here or over here, that's not your bladder. Your bladder is centered. It's directly under. It's in a straight line from your belly button down to your crotch. All right? Now we got to put the bowel in, the rectum in, right? So that gets, all right. All right, so look, so now I got that in there. So pelvic pain is remarkably challenging to diagnose because nothing operates in isolation here. Nothing operates in isolation. You know, and this is where Western medicine fails the typical IC and pelvic pain patient because doctors like to stay in their sandbox. They don't necessarily go outside of their sandbox. So if you got, let's say you got bladder pain, frequency urgency bladder and or pelvic pain, and you go to a urologist, okay, they're going to be looking at your bladder. But you take those same symptoms to your gynecologist and they're going to be looking at your uterus and your vagina and your ovaries. Which is why so many women have had completely inappropriate hysterectomies. You know, they remove perfectly normal uteruses and ovaries, only to discover after the fact it could have been their bladder. Gastroenterologists are going to stay with the bowel. And they don't study relationships. And that's what Dr. Weiss says in his fabulous book, Breaking Through Chronic Pelvic Pain, that I recommend highly, is that nothing operates in isolation. Everything influences each other. Why? Because their nerves merge up here. We know that all the nerves that spread out into the pelvic cavity all end up at the same nerve bundle at the lower spinal cord. And I have a picture of that too if y'all want to see it. So we have something called neural crosstalk. We know, for example, that if the bowel gets irritated, the bladder will also probably show signs of irritation through this something called neural crosstalk, nerves talking to each other. We also know that muscles now play a huge role in this. You go back 100 years and you look at some of the early papers on IC, they describe muscles so tight, they're like tight piano strings. Urologists describing muscles so tight, they're like tight piano strings. But they never treated them because they were urologists. They was like, okay, if he has tight muscles, no biggie, we're going to work on the bladder. Now we know that muscles so tight, like piano strings, can cause catastrophic effects to everything else in the pelvis. Why? Because tight muscles restrict blood flow. It's called ischemia. It's going to be very hard for the bladder to be healthy and the vulva to be healthy and the rectum to be healthy if it's only getting a fraction of the normal blood supply it should be getting. So ischemia is one thing that we want to look at. So there are two reflexes you need to know about. I'll give you a little advanced lesson here. The first one is called the viscerosomatic reflex. Viscero standing for viscera, standing for bladder organ. Somatic standing for muscle, etc. So the question is can an organ like your bladder change your muscle behavior? And the answer is absolutely. If you're in pain, your muscles are going to get tight to protect you from that pain. That's called the guarding reflex. So if you're going through chemotherapy and the chemo's frying your bladder wall and your bladder screaming in pain, your muscles absolutely are going to get tight to protect you from that pain. You have no control over that. That is the way the human body is wired. So our therapeutic priority for the chemotherapy patient is to calm the bladder wall down. When we calm the bladder wall down, we hope that the muscles will release. So we know 100% that a dysfunctional organ can change the way your muscles are behaving. But there's a far more important, fascinating question, and that is, can muscles change the way an organ is behaving? And the answer is yes. Yes. Because if you have a muscle injury, a muscle trauma, extremely tight muscles, that affects blood supply. So not only is the bladder now not getting the good oxygenation and nutrition it needs to be healthy, but the critical capillaries that support the nerves are also not working, because nerves need good blood supply to function. And if the little capillary that is in that nerve fiber with that nerve is damaged, that nerve can now not function correctly. So now we're dealing with neuroinflammation or dysfunctional nerves, for lack of a better term. So the long-term effect of tight muscles is we've got poor blood supply combined with dysfunctional nerves. Those dysfunctional nerves then talk to each other, and that dysfunction spreads. So some of you have something called allodynia, where other areas, so like for me, I went through about a 3-month period where you couldn't touch me below my belly button at all. One little tiny touch would make me scream. Like, what the hell is that? That was allodynia. That meant that the nerves in my pelvis had become massively inflamed, and that inflammation was spread to those other proximal nerves in my skin. And it took about 3 months for that to go away, right? As the nerves calmed down, that went away. So our challenge here is that you don't know you've got the equivalent of a nerve injury or a muscle injury. Your first symptom is frequency urgency. So you go to the OBGYN or your urologist, say, hey, I think I've got a really bad bladder infection. The urologist says, all right, let's give you some antibiotics. They throw antibiotics at you. You take them. You might get better for a couple days, but it comes right back. You go back to the doctor. The doctor goes, well, we need to do a urine test. Let's see what we're working with here. Your urine culture comes back negative. The doctor's like, well, I don't know, but you can take antibiotics anyway. Why don't you take prophylactic antibiotics for 6 months? Not understanding the damage that's then going to do. Well, 6 months go by. You're no any better. You go back to the doctor because now you can't sleep. And the doctor goes, you know what? I think you've got overactive bladder. Let's give you Detrol, ditropan, or now mirabegron or Mirabetrek. And you're a good girl or guy. You're like, all right, let's do it. I want my life back. So for 3 months, 4 months, 5 months, whatever, you take the medications. But ultimately, you're here. Come here. Come here, Dad. Ultimately, you're not getting better. So then you go back to the doctor, and the doctor has the dreaded, I think you've got interstitial cystitis. You guys, okay, you gotta zip up here. You guys say hi to my dad, Jack. We're Jack and Jill. My brother's Jack too.
Delay.
What?
Delay.
Well, this is Facebook. This is YouTube. He is going to be 99 years old in exactly 2 months.
In November. Perhaps.
Peony says, hi, Dad. This is the guy who, through thick and thin, he and my mom, boy, when I couldn't care for myself because my pain was so bad, He drove me to the emergency room. He sat at the doctor's office. I mean, having the people around you to love and care for you is so important. And it's so hard when they're not there, right? All right, so let's get back to our model here. So you've done your overactive bladder meds, they're not working. And the doctor gives you the dreaded IC. Girl, I hate to say it to you, but I think you've got this incurable bladder disease called interstitial cystitis. Here's Elmeron. Here's the diet. Here's a supplement. I'll see you in 6 months. And you're good. You're good. You want to get better. And so you do the Elmeron. You do the medications. You have the tests. You follow the diet. 1 year, 2 years, 5 years, 10 years, 20 years, and you're still not better. Why? What the American Urology Association says is if you are not improving, or if you're getting worse rather than better, stop what you're doing, take a step back, and revisit the diagnosis. Because this is what we know. For that muscle injury patient, you could be on bladder therapies for your whole life. You'll never get better because the bladder therapies don't fix the problem, which is blood supply. Our therapeutic priority for the pelvic floor injury is to restore blood supply. How do we do that? By getting the muscles in better shape. We do physical therapy. And in 2008, when our first pelvic floor physical therapy study came out, was funded by the National Institutes of Health. It was a multi-center study around the United States and Canada. They were stunned that muscle therapy outperformed bladder therapies in improving patient symptoms. And that was the moment in 2008 when the IC world was turned on its head. Because prior to that point, everybody was going bladder, 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 bladder. But if it was a bladder disease, why the hell would physical therapy cure some people? And the reality is that physical therapy does cure some people. Uh-oh, maybe this isn't a bladder disease in some people. Maybe it's a muscle problem in some people. Again, going back to 100 years worth of papers describing muscles so tight, they're like tight piano strings. So for newly diagnosed patients like Becky, who was just diagnosed a week ago, at that very first appointment, they should have done a pelvic floor assessment. Let's see what's going on with your muscles, because the earlier we catch the muscles, the better it is. The better it is. So that was a long-winded explanation for you, Becky. I hope you're still here. Mary says, when your bladder wall is bad, can everything bother you? I think even salt does. Well, you know, what's one of the earliest forms of torture but rubbing salt into an open wound? And so, you know, for patients who are just learning about this, what we say is let's avoid acid and salt. So you definitely want to back off on the salt. We really don't want you to do really salty pretzels, something like that, because if you've got open wounds on your bladder, that's going to hurt. Matt says that the IC 101 book, some people are just jaded. I'm finding it very useful, still digesting my way through it. Matt, if you could leave a review on Amazon, I'd really appreciate it. Becky says, my appendix ruptured in August of 2020, and that's when my problem started. That's real. You know, honey, that's really interesting. That's really interesting. For a couple of reasons. So I'd have a couple of things going through my head. Number one, you had the assumption here is that your appendix was massively infected, and if it ruptured, you would then have had infection put through your belly potentially. And so we would be wondering, is there any legacy infection going on there? Probably not, but it's worth talking about. But again, you're in pain. Some of the worst pain a person can have. You've had a ruptured appendix. Your muscles locked down big time because of that pain. And so that's the other thing we would be looking at is the legacy of that trauma as well as any surgery you had on those muscles. Hello, Mary from Canada. Lori says, what can be done for a bad SI joint? Dr. Weiss talks about that in Breaking Through Chronic Pelvic Pain, his fabulous book. Prolotherapy. So the SI joint, which is, I don't know if you can see this joint right here, right? It's where the hip bone attaches to the sacrum. On the back side, it's right here. This joint is meant to be very firm and stable. It's not supposed to be moving much. But in some people, it starts to move. And that's what mine does on my left side. My left SI joint is is um, what's the right word for it? Well, it's just unstable. And it turns out I was a very good tennis player. I played professionally a little bit. Um, I'm right-handed, and my physical therapist, who happened to be the physical therapist for the U.S. Olympic team, said this is the tennis injury. Right-handed, stepping on my left foot, put all my weight on my left foot, all my weight on my left foot, rotating as I'm swinging. That puts tremendous pressure on that joint. And on the tendons and the ligaments that hold that joint together. And so the last step for me is something called prolotherapy, where they go in and they inject a irritating solution into the ligament to force the ligament to heal and tighten. And my OBGYN has only done it no, my physiatrist has only done it a couple of times, and he warned me. He said it's very bloody. And then COVID hit, and we couldn't do it. So, oh, I still want to do that. Candace says, check out Isa Herrera's work concerning pelvic floor. I did her course in 2007. Yeah, Isa's wonderful. Well, Mary, it's the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? Listen, they're both involved. They cannot not both be involved. They are two interconnected, but one is normally driving the other. So again, for the patients who have the chemical injury to the bladder wall or chemotherapy or whatever, then we have to focus on the bladder. And just hope that as we reduce pain in the bladder, we reduce the muscle clenching. But we also have to understand the muscle injury that the muscle injury could be creating the foundation for all of these symptoms also. Matt said, Jill hit the nail on the head. I've taken all the drugs she mentioned and a few others. I got to say, and listen, I've got people who like what I do, and I've got a couple of people who like to send me messages saying that they disagree with what I say, and that's fine. All I'm doing is giving you my perspective, and I hope that what I'm doing is inspiring you to do more and to do your own reading. I'm giving you my perspective. I'm going to say this, that the great majority of men that I work with have pelvic floor injury. The great, great, great majority. Because I take those phone calls every week, every day. I can't even remember the last guy I worked with who did not have a pelvic injury. So anyway, and yes, I know people disagree with that, and that's fine. That's just my experience. Lori says impossible platelet-rich plasma injections. Yeah, that would be very interesting. Lisa said I did Botox injections 2 weeks ago for IC and pelvic floor. If that can help calm the muscle, get that muscle out of tension, power to you. Laura says, where do you apply topical estrogen? Usually vaginally and or at your urethra on your vulva. If you're having urethral symptoms, they usually have you rub a little bit at the entrance to your urethra, which is what I did last night. Sylvianne says, I would love to order the new IC 101 book. It's on Amazon now, and the Kindle I uploaded yesterday. And so, let's see. Let me tell you guys, Amazon is a beast trying to get stuff on there. Let's see if it's available in the Kindle store yet. I said I had to wait 24 to 48 hours. So let's just see. And again, not everybody's going to agree, and that's fine. That's fine. It's okay to disagree. Yes, it is on Kindle. Oh, praise God, hallelujah. 2 months, 9.99, my friends, 9.99 on Kindle. That is exciting. And we're already working on our next round of changes, by the way. Okay. Peony says, I was nearly pain free for 7 years. The only thing that's changed is my uterus now tilts backwards. Would pelvic floor therapy help? Because that's the only thing that's been offered to me. It could. Absolutely, it could. Peony, you got to remember as we get older and our estrogen levels start to drop, our muscles start to get a bit weaker. And that's often why we start suffering with prolapses and things like that happening. And so the sooner you get yourself into pelvic floor physical therapy before the prolapse becomes so severe that surgery would be required. So the sooner we can find that muscle injury, the better we can retrain those muscles before the muscles get really stretched out and unfixable. So I would definitely be going to pelvic floor physical therapy and seeing what they can do. I mean, at least have a pelvic floor assessment and see, at least try to see what they can find, right? Hey, Sue, long time no see. Girl, I think about you often, and I saw your email. Have you ever found that comfortable car that you've been looking for? I'm in the process. Oh, God, it's so much harder now. Sue, I have driven every midsize SUV that I can find. And my go-to was Buick. I had a Buick Rendezvous, which was a dream. The cushions were perfect. I had it for 13 years and I gave it to my nephew. Stupid. What a stupid thing I did. Because they've now changed all those seats. And so now the new Buicks, so the new Buick, the Buick Enclave, well, any of the Buick SUVs, as well as the Volkswagen Atlas, as well as the Subaru, as well as the Chevy Traverse, as well as the Buick Enclave, they all have hard chair cushions that push right up into your tail. Oh my God, I'm so annoyed. Um, I want to see if I can draw this. Hold on a sec. Okay, so here's your normal seat for a car seat, right? So what they told me is consumers want something sportier that looks more expensive. And so now all these cars have, um, let's see. I'm going to try to draw this. Okay, so now these car seats are circular, right? So and there's this piece that pushes right up against your tailbone. So I drive a Nissan Rogue right now. That seat's fine. So I would look number one at the Nissan Rogue. The Nissan Pathfinder, the brand new ones just come out, also has a great seat. And so does the Ford Edge. They're just too small for me because of evacuation. So I was thinking I was going to try to get a Chevy Traverse or a Buick Enclave, but and guys, it's just for evacuation purposes. Okay. I mean, this is our life now. I can barely evacuate 3 people in my small SUV. I need a bigger car to get more stuff out if we have to leave. I've driven everything. I've driven the Subaru. I've driven the Volkswagen Atlas, which looks great on the outside. The seat is shit. I've driven the Volvo. I've driven the Traverse. I've driven the Enclave. And I knew I knew the Rendezvous was the right car for me 20 years ago because it was the first car that made me cry in a good way because it didn't hurt at all. And I started crying direct test driving it with the guy. It's like, oh my God, it feels so good. The Nissan Pathfinder felt pretty good, but none of them are as cushy as the old Buicks. Of course, you can always pay somebody to rebuild you a car seat, but if you're gonna, it's a lot of money. I'd like for it to be reasonably effective. Buying cars sucks. I hate it. I would just like to hire somebody to buy the car for me. Sue, I want to hear at some point in time how you're doing with that, with your thingy. I know COVID stopped everything, but I'd love to hear how you're doing. Mary says driving and being the passenger is rough, especially if you have any driving anxiety that can trigger pain. I'm going to agree with you. My first 5 years before we got my bladder healed was I just really couldn't drive in a car anywhere. I mean, driving 2 miles was like driving across the country for me. It was so painful. And hitting every speed bump, oh my God, so awful. Um, and then some cars have a little shimmy, as you're driving it. It's like I was gonna buy my neighbor's. They had a handicapped assist minivan, Toyota, and it looked perfect until I drove it, and it had this side to side shimmy, like my mom's old Dodge Dynasty. That no, was not going to work at all. But I can drive now. But my fantasy, so my long-term fantasy dealing with this is that, and I have a friend in Marie in Reading whose husband did this for her, is to have a minivan that actually has a porta potty inside it. And now my parents are so old, having a ramp so they can get up in the car is important. Um, And when I actually saw it and saw how easy it would be, you take the second row out, so you've got the first row and the third row, and you've got this big empty area. You could easily put just a little porta potty in there. And then the best strategy is you have plastic bags and you put cat litter in there. You can pull over anytime you want. You can pee into it and then just wrap it up, seal it off, and you're good as gold, and you don't even have to get out of your car to pee. Or you can use where are they? Travel johns. Travel johns are what pilots use, especially in small planes or fighter pilots. I mean, I've worked with fighter pilots with this too. And so basically, it's like this big. You can easily keep it in your purse. Keep a couple. I always have a couple in my storage area in my car. And then if you need to pee, the lip is perfect. You just drop your pants, squat over it, and pee. And there's powder in it so that it immediately solidifies. So it's not like it's ever going to leak. And it's hygienic too. And then the next trash can you see, you just dump it in the trash can. So you can have travel johns, or if worse comes to worse, and I have this in my car too, a plastic, a big garbage bag, couple of garbage bags, and a couple of old rags. And so if you're driving a far way and there's an emergency, what you do is you put the garbage bag on your car seat, put the rags on top, sit on that, pee on that. And then when you're done, you just wrap it up and throw it in the next trash can. There are ways to make this happen, but there is a tremendous amount of fear associated with restroom access. Getting on a plane, that's hard. So if I'm flying somewhere, all you got to do is tell me I need to get on a plane and I will absolutely have a pelvic floor flare. I will have a flare. I will be in the bathroom all night peeing and pooping. I will. That's how my body handles stress. And then, usually the next morning I'm done and I can take the flight no problem. But whenever I do fly, I either sit in the very last row, in the very, very, very last row, right next to the bathroom, so that, man, I can get in there and out of there like that. Or if you can afford it, business class, because there's a bathroom of business class. And the reality is the flight attendants in business class are much nicer and much more receptive. And the funniest story was I was sitting, um, uh, I think I was flying to a San Antonio to a AUA conference, and my knee, I'd fallen asleep, and my knee had come out into the aisle, and the flight attendant didn't see it, and she was bringing along the big cart, the food and beverage cart, and she slammed into my knee really hard, and I was fine. And she was like, "Oh my god, I'm so sorry. Did I just break your knee?" And I'm like, I don't think so. I think we're okay." And she goes, "Oh, can I do anything for you at all?" And I said, "Yeah, I'll tell you exactly what you can do for me. If I need to pee, will you please let me pee? Will you please let me get up and use the bathroom?" She goes, "I got you, girl." And she was great. She was great. Or you can have, so I'm not saying do that permanently, but we do have, where is it? Okay. Or you can do restroom access cards. It's always good to carry one of these if you're going to get on a plane, or better yet, actually order a medic alert bracelet or a medic alert card that costs money. But, my first couple of years, I wore a bracelet that said, this patient has interstitial cystitis and may require urgent restroom access. Our medic alert card on the IC network, and I'll make you a deal. Anybody who wants this, I will send it to you free. All you need to do is email me, icnetwork@mac.com. Email me your mailing address, and I will send you this card, and I will send you this card, which is our diet card, foods to avoid, and bladder friendly foods, usually bladder friendly foods. Okay, so this can work in a pinch. But sometimes airlines want a letter from your doctor or an official medical alert card. So, and what does this say? The holder of this card has a medical condition, interstitial cystitis, prostatitis, or pelvic pain syndrome that requires frequent and urgent restroom access. It is difficult, if not impossible, for this patient to hold it without enduring severe pain and/or bladder spasms. Please provide restroom access to this patient. Your cooperation is greatly appreciated. We've I mean, we've sold thousands of and I've given away thousands of these too. So if anybody wants a medical alert card, let me know. Send me your Gwen says she has both. Yeah, awesome. So let me know. Send me your address, icnetwork@mac.com, and I'd be more than happy. Look how many I got. How many do I have here? I got about, I don't know, I got about a dozen of them. Oh no, there's more. Otherwise, we have them up in our store. That's up at our warehouse. Sue says, just starting to get back out there, having hip tear surgery in 2 weeks. Oh, and you lost your dad. Oh, I'm so sorry, honey. You were hospitalized with a collapsed lung and TIAs. Holy crap, Sue. Oh my God, girl. Man, you know what, guys? Never, ever, ever, ever think that IC patients are weak. You are tough. Sue, you are tough. And you had think about everything you've done, everything you've gone through, and here you are today, able to help other patients. We are so blessed that you are in the room, and we are so blessed for every one of you to speak out. It's IC Awareness Month, my friends. What have you done for IC Awareness Month, huh? What have you done? Anything? Have you shared our daily facts in your Facebook feed or your Instagram feed? Have you done a TikTok? Have you sent out our press release to your local doctor talking about COVID cystitis? It's all right on our website, icawareness.org. And I realize that we got a lot of other things we're dealing with COVID, but still, we need posters for a poster contest. We need memes for our meme contest. Our winners will get $100 gift cards from Amazon. Second place will get $50 gift cards. Third place will get $25 gift cards right before the holidays. So, I mean, please play. Grab crayons, grab an online art thing, something, and make a paper. I mean, do a 8.5 by 11 poster that talks about, it shares your life with IC. No major interpretation here. This one right here was created the first year we did it, like 10 years ago. And it's still our top poster. I mean, this was amazing. We stand together, icawareness.org. But you know what? Have fun with it. Get your kids to draw a poster. Use your pain constructively. If you're up in the middle of the night and you can't sleep, get out of bed go turn. It helps to get out of bed. Go turn on a really bad movie, and or get your computer or your laptop and write a letter to your senator or congressman and tell them how bad you feel and why it's so important that they fund research for IC. We need research money, but I granted COVID is messing everything up right now. So if you want some more cards, let me know and I'll send you some. Okay. How do you get hun, if you go over to icawareness.org, we give you the address and you'll actually just mail it to me. You'll mail it to me and then I'll put you in that way. Okay. And then what I'll do is I will make it electronic for you. Okay. I will absolutely make it electronic for you. All right. All righty. Hey, I do want to take a moment and I don't know how many people we have left on Facebook. Due to new, it's not showing me. So we got about 20. All right. So we got about 35 people watching so far. Or 30. I want to I want to take a moment and I want to talk about 9/11 for a moment. Um, and I want to share an IC story with you. So yesterday was our 20th anniversary for 9/11, and we didn't have Facebook then. What we did have was the IC Network Forum. And that's where on our website, the great majority of IC patients online, we had 200,000 patients a month using our website back then. We still have, about 100,000 using it every month. But back before Facebook, I mean, we just massive, massive traffic. And I woke up early that morning. I don't remember why. It was like 6:30, and I had a radio on next to my bed, or turned the radio on, and I heard about this plane hitting the World Trade Center, and I heard the fear, and so I got up and um, went into my family room and turned the TV on and saw, and I actually saw the second plane hit, and I knew that I had patients in the IC Network Forum who had family there. And so I immediately came back right to this very room that I'm sitting in now, and went into the forum. And I had IC patients whose husbands and daughters were in the World Trade Center, and they didn't know if they were making it. And it was a stunning, stunning moment, um, where we all had to put aside whatever else was going on and give these patients love. Love. And it was so hard. We had then, later that evening, somebody who came in who said that the attacks happened because um, it was some sort of religious argument. And they got into, I then had a religious fight on my website, and we shut them down. The World Trade Center was not because of a religious belief. The World Trade Center was because it was an act of terrorism. And we're not going to blame this on somebody who believes one way or the other. Our religion, our faith has nothing to do with it. It was an act of terrorism at that moment. It was not an IC patient being punished because she didn't believe the way the other IC patient believed. And that's kind of what was going on. You know what I mean. But we got through it together. We got through it together. Diane, who helped me start the IC network, lived in New Jersey. She saw the smoke. They were watching it. And I am so incredibly proud of the IC patient community that day who stepped in and helped as many people as they could. There were no Republicans or Democrats. We were Americans. We were Americans. And now, today, we are having a 9/11 virtually every day. 3,000 or more people dying a day of COVID right now. Think about the stress we went through 20 years ago, the trauma, I still remember the F-16 flying over my house, and we were terrified. It flew from south to north. It was like that afternoon. And we thought for sure that there's gonna be some sort of fight. And that lasted a lifetime. And now today, because of COVID, we are at war with a virus, and we are suffering a 9/11 every 1 or 2 days in deaths. And it is shocking. It is shocking that so many people have been traumatized. So many families have been destroyed. We should be united as Americans to fight this virus, which is so much worse than any of us could have imagined. And the toll that this tragedy is taking on our care providers is astronomical. This is not about being a Republican or Democrat or independent. This is about trying to save lives. And so I just want you guys to think about it that way, that we are suffering a 9/11 every day or two in fatalities because of this virus. We are at war with a virus that is changing and adapting, that is doing its best to destroy as many things as it can, because that's what viruses do. And I just encourage you to hold your hand out in love to anybody that you know who's suffering. Please, please, please treat those doctors and those nurses with kindness, compassion, because they are living a 9/11 every day. And they are exhausted. A year ago, we were ringing bells because they were heroes. Today, people are attacking the very people who are trying to save their lives. Please don't be one of those people. We must work together. Now, this is what I'm doing. Now, listen. My very first class at UC Santa Barbara, when I got my pharmacology degree, was public health. And we were talking about HIV. And what they said in my class in 1980, my first class at UC Santa Barbara for my pharmacology degree, was about HIV and how terrified they were that it would become airborne and how many lives it would take. Because of that class, I did not sleep around in school. And my county, Sonoma County, was a center for HIV at the time. So all those people who were in the 60s who had great sex and they had all this fun, yeah, not this girl. Not this girl. I'm sorry, but it scared the hell out of me. HIV scared the hell out of me. COVID is worse. It's worse. It has the potential of being worse. And so, because it progresses very, very quickly, and you get the cytokine storm reaction, and it's not a respiratory virus, it's a circulatory system virus. It attacks your blood vessels. We now know that men who get COVID often suffer with erectile dysfunction. And now, because think about it, having an erection is about blood supply. But if you have a virus who's limited your blood supply, you guess what? You might not be able to have an erection for the rest of your life. That's a good motivating factor to some people. So I just want to say, listen, this is not about politics. This is about us working together and caring for each other. And we can do it. And so please, 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 whenever you can, be kind to everybody who's suffering. We're going to hopefully get through this. 20 years from now, when we look back on this 20 years from now, when I'm 81 years old, I hope that we will be able to see that moment where we really did make that change. Arlene says, I was in Sonoma County and now I'm in Florida, right? Because of Guerneville, right, Arlene? Guerneville was the reason why things were touched. All right, my friends. Here's your homework. For 15 minutes a day, I need you to do something that will calm your soul and spirit. Get outside, sit in the sun, take a walk in nature, go to church, whatever floats your boat, do it. We all need a little bit of peace right now. Find your peace. For 15 minutes a day, I need you to do something for your IC or your pelvic floor. Go get your wand and do your pelvic floor work. Get on the floor in your living room, do the exercises, or make an IC-friendly meal, whatever. Every day, 15 minutes. For 15 minutes a day, I need you to do something for your noggin here. Let's get your knowledge level up. And we have such good information about IC now and also about COVID-associated cystitis. So come on over to our website. Read a freaking blog a day. Come on. Come on. You are what you take in, right? And so it's important that we do not rely on Facebook for all of your IC information. It's like the worst place you can go. We need you to get the really basic fundamental information. And, this is this is a good place to start, right? One chapter a day. Come on, guys. I edited this and I wrote huge portions of it. You can read this. And then last but not least, I want you to laugh hysterically for 15 minutes a day if you can. Come on. Laughter modulates pain. It will improve your pain levels. It will reduce pain. It will make you feel better. You'll start producing some natural painkillers, such as endorphins. If you can get out and walk a little bit, that will help too. But let's try to get some laughter in your life. And God knows we need it right now because life is hard. Okay? There's one other thing I was going to say. I have now. Candace says, I guess I needed the anger to get serious too. Wow, I felt the same way you did. I was not going to let the doctor tell me who I was or dictate how this was going to unfold. Exactly, Candace, right? All right, guys. How much is the book on the IC network? The book is the same price everywhere, honey. It's $9.99 as a PDF file or Kindle, and it's $24.99 if you get the actual book. And the reason why it's so expensive is because that's how it costs like literally $19 to print it. Because we didn't go to China and print up 5,000 of these. We had to do small print runs. So it's more expensive because of that. Plus, it's 8.5 by 11, and it's heavy. It almost weighs 2 pounds. All right, but you can buy it. We can ship it to you media mail too, and that reduces shipping massively. Yeah, yeah, Arlene, it's crazy times, right? All right, my friends. Thank you for your patience with my casualness today. I appreciate it, and I truly wish you a fantastic week. We are in this together, and you will see me again this week. Probably on Thursday. I'm doing my drop-in meetings on Facebook on Thursday. I haven't started drop-in meetings on YouTube yet. I also want to start filming some TikToks now that we've got most of the book done. So anyway, I wish you well. Hugs to everybody. If you have any other questions, you can always email me, icnetwork@mac.com. All right, guys, I'll see you later. Have a good one. All right, YouTube is done.